Good afternoon, everyone. My name is Michele Drielick, and I am the Clinical Director here at Liberty Direct. For the next 45 minutes or so, the goal today is to give you an overview of the program, learn a little bit about the history of medical cost sharing, and exactly how the program works. So with that, I'm going to go ahead and get started. We like to say that we are healthcare for the health conscious, which I believe, given the audience today, I've worked with Dr. Carter and his team for a while. I know that the folks on this line are also very health conscious. And so we look at it like we are really changing healthcare for good, right? For good in many ways. So we'll talk about that a little bit more as we go on. So I know I'm probably preaching to the choir when I say that healthcare, right, has become unaffordable. If high premiums weren't enough, now we know that high deductibles are also something that we're seeing soar. And what that really does is it places most consumers in the position of carrying mostly catastrophic coverage, right? So you're essentially, you and your patients and your neighbors and your community, most people don't realize when they have a high deductible plan that that just means that you're paying out of pocket for all of your health care until you hit that certain threshold. And very often with deductibles on the rise, that threshold equates to a catastrophic event. So what we've noticed is that because of that, our system is more focused on these medical catastrophes. We're focused more on disease care. There are some economics that happen or some reactions to healthcare that happens when premiums and deductibles are on the rise. One thing that we do know, if you're like most of us that are conscientious about their health and prioritize their health, you recognize that that is actually not rewarded. In fact, you are the subsidization of the system, right? Those people that do not use the system frequently enough, but are paying into it significantly, are subsidizing the disease care system. Again, I know I'm preaching to the choir on that. So what this boils down to is that most Americans out there today are really funding their own health. And when they're doing this with these high deductibles and high premiums, the economics of it make it such that consumers naturally are ratcheting back their care, right? Because every time they go to the doctor, it used to be just a copay, but now it's the whole office visit. And because of that, they're making these decisions to maybe forego a medical opinion or a second opinion in order to save some money. Likewise, because of the exorbitant rates that they're paying for their premiums, they are left with less discretionary income to spend on health promotion, right? And healing and being well, whether that's organic foods at the grocery store or visits to alternative and integrative and functional providers. And then ideally, I mean, as everyone knows, we're just seeing primary care dwindle and dwindle and dwindle in terms of the time that a consumer or a patient gets with their doctor. So it's very quick medicine these days. Primary care is meant to essentially triage now, where it used to be based on relationships. And so know that as providers are feeling this too, right? We all know people that are struggling in this world to make it. And we know that their time has been cut down to roughly 7 minutes per patient. Like I said, they're turning into a triage system rather than a care delivery system. On top of that, their reimbursements are going down, right? And so this creates another economic environment where there's no time for a relationship. There's no time to find the root cause of the problem. There's really only time to write a prescription. And this is not the direction that we want our healthcare system to go in. On top of that, there are more and more regulations that are being placed in front of providers today that if they want to practice on top of their malpractice stuff, now they've got to worry about CMS and violating and numerous new pieces of law that are out there. So we find that they're either selling out to hospitals, they're leaving medicine, they're working in ERs, they're really just changing their delivery or we also know that they're moving more into direct primary care as well. And we'll talk about that in a minute. So we've all agree here that Americans need a better way. It was clearly a topic for discussion in the elections this year. Even before that, it's always been a hot topic of discussion. We need a better way. And so when developing the Liberty Direct program, we knew that we needed a not only to find something that was affordable, right, but that was predictable as well. So I will give you a great example. Liberty has rechartered 5 years ago. We've been in medical cost sharing for 20 years, over 20 years. 5 years ago, we rechartered to be open to people of all faiths. And in doing so, we have never raised our rates in those greater than 20 years. However, legally for our ACA exemption, we can only say for the past 5 years because that's when we rechartered. So our rates have not been raised in the last 5 years. So there's none of this uncertainty about what the next year is going to look like. The other thing is we wanted to create a system that actually rewards people who prioritize their health, as opposed to punishing people that prioritize their health, right? With carrying the burden of the healthcare system on their backs. And we also wanted a system to be there before there is a catastrophe. If you're paying out of pocket, or a consumer's paying out of pocket until something horrific happens, then that's not really being there for them. That's only preventing them from going bankrupt, right? So we wanted a system that engages with our members much earlier on and financially works for them much sooner than a medical catastrophe. And so I'll give you a brief kind of overview as to healthcare cost sharing. Just to be clear, Liberty Direct is a program that is administered by Liberty Health Share. Liberty Health Share is one of the main organizations that has been granted this Affordable Care Act exemption, so that if anyone joins Liberty Direct, they are exempt from the mandate to purchase insurance. But this all started, as I said, well over actually hundreds of years ago, right? The idea of communities of people kind of bearing one another's burdens is nothing new. It's not anything that is recent in American history. Basically, it's been going on for hundreds of years. But in the late 1980s, four main organizations kind of realized, hey, we've been doing this for some time now. It probably makes sense for us to organize, incorporate, and start being a little bit more structured in how we take care of one another as our communities grow. And so they did just that. And there are multiple cost sharing organizations out there. So that naturally, when the ACA legislation was proposed and passed, these organizations kind of raised their hands up and said, hey, wait a second, why do our members have to go out and purchase health insurance? We have been taking care of one another all along. And so we would prefer to be exempt from those regulations. And they were thus granted this exemption from the Affordable Care Act. So just to be clear, it's not a compliance with the Affordable Care Act. We are actually exempt from it. So you'll see a few ways in which we're able to implement the program in such a way where it may not have been legitimate with the ACA compliance, but because we're exempt, we're able to do things like that. And we'll talk about that as well. And so finally, as I briefly mentioned, Liberty rechartered about 5.5 years ago, to be open to people of all faiths who simply subscribe to our shared beliefs. And so that's all available online, and we can go into that a little further if everyone would want to delve into it. But just to let you know, we are one of the only medical cost sharing organizations that has this ACA exemption that is open to people of all faiths that participate in our shared beliefs. So also related to that exemption, there's an area of our website for our members so that they know exactly how to file their income tax with that exemption. And you can see there's a code on here that allows them to know that they're compliant. So let's talk a little bit about how it works, okay? So I want you to think of people all across the country, right? We've got over 90,000 members right now nationwide, all across the country. And everyone receives what's called a share box. It's kind of like an online banking account. Okay, just kind of think of it that way. You have an online access into your share box. And so every month you pay a monthly share amount. Again, we don't use terms like premiums or deductibles or coverage and things like that. We use other terminology. So your monthly amount is called your monthly share amount. And as a member, you just pay this amount each month. And that amount goes into your online account, your share box. And so when you incur a medical expense, you visit the doctor or visit another healthcare provider, you incur that expense. Your doctor will bill Liberty electronically. Some of them don't, and if they don't, you would either pay the bill, or in an instance of like larger institutions, hospitals, and so forth, they just bill you. And when you receive the bill, you submit it to us. Okay. And then our team will actually process that bill. And what's interesting, and this is where it becomes medical cost sharing, as our team processes the bill, they go into other members' share boxes and shift money into your share box and pay the bill from your share box. Okay. And the reason why we do this, it certainly is more complicated than just having a single bank account where we just pay everything. The reason why we do this is because it's completely transparent. We want all of our members to see where their money is going. It's anonymous, right? So it's not like your private information is shared, but you know that your money is going to help other people. And likewise, when you incur a medical expense, you're able to see those dollars transfer into your share box and get paid from there. And so after that occurs, that payment moves from your share box, it pays your eligible medical expense, and then you'll receive a confirmation that that payment was made. The great thing about your share box is you could literally walk out of a provider's office with an invoice in your hand. You could take a picture of it with your smartphone and upload it right into your share box. And that is how you submit medical expenses for reimbursement or to have them applied to. Again, we don't use the term deductible. We say your annual unshared amount. So it's the amount of money that you're required to pay before you're eligible to share with the community. And so cost always comes up, and I just want to kind of orient you to what this looks like. So your monthly share amount is the amount of money that you pay each month into your share box that is used to pay your own medical expenses that are eligible, or those medical expenses of others that are eligible in the community. So we break it down by individuals, couples, and families. And we also further break it down by the age of either the individual or the youngest spouse. And so if it's a couple or a family, and one of the parents or one of the adults is under 30, then the entire couple or family benefits by getting that less expensive rate. So that should make sense. So we also have rates for single adults with one child and single adults with multiple children. And so just by way of making it easy, the couple rate under 30 is what a single adult with a single child would pay. And the family under 30 is what a single adult with multiple children would pay. Okay, it just gets very complicated on this chart. So we just leave it off and just address it afterward. Now, this is what your monthly share amounts would look like. And then the amount that you are paying out of pocket before your eligibility kicks in and you're able to share your medical expenses amongst the community are listed here as well. And so if, for instance, you're an individual over 30, you pay $199 per month as your monthly share amount. And then the first 500 over the course of the entire year, the first 500 medical expenses are paid by you. And then from that point forward, all other eligible medical expenses are either reimbursed or paid on your behalf. The same thing with a couple for $1,000 and a family for $1,500. So that should make sense to everyone. So the other thing I hear all the time is this is too good to be true. And I want to address it because for people who prioritize their health, absolutely it seems too good to be true. Because finally, people are able to pay for the amount of medical usage, I guess, that is anticipated from a generally healthy population. Okay. So, however, you could see very quickly as we go through the how Liberty operates, you could see how quickly how it is not too good to be true for everyone. And so, first of all, it's worth mentioning that Liberty is a very lean organization. It's a nonprofit, but it's actually run like a very lean nonprofit. In fact, when a new member or a member household or a couple, whenever one of those entities joins Liberty and becomes a member, only $24 each month of that money can be used by us to administer the program. Okay. So if you know anything about health insurance, it's upwards of 50 cents on every dollar spent is on administration. So that's exorbitant CEO salaries, right? It's lots and lots of expensive technology and things like that. And so we only take $24 per household per month out of that amount of money, that out of the monthly share amount, to actually administer the program. So again, very, very lean. And the other thing is, because we are exempt from the ACA, we don't have to accept everyone, right? There are people, and you can imagine this, whose medical burdens are just too great. They just have too many combinations of chronic illnesses for the member community to be able to take care of them and for them to be equalized amongst the community. And so it doesn't really work out for us that way. So about 3 to 4% of the applicants that first apply are not approved. I'm asked all the time for what that algorithm looks like, and there is no algorithm. Every application is evaluated individually based on the questions that are answered and the responses that are given. And so I can never just tell someone, you would never be accepted. However, if anyone applies, you'll know within 5 to 7 days and be able to decide from there. Okay. Whoops. Okay, so 5% of the people who apply are approved with pre-existing conditions, okay? And so pre-existing conditions is a very generic term that is applied in healthcare very loosely, so I'm going to define it for everyone. I want to start off by saying that every member of Liberty has $1 million per medical incident, right? So a heart attack, cancer, diabetes, COPD, all of those are medical incidences, right? Ear infection, whatever. So you have up to $1 million per medical incident, okay? So pre-existing conditions are handled a little bit differently. First of all, we say a pre-existing condition is any condition that's been diagnosed or treated within 24 months of becoming a member. That's it. So if somebody had cancer 10 years ago, it is not considered pre-existing to us. If they had a melanoma last year, then that melanoma and any surveillance, treatment, or recurrence going forward is treated differently, okay? And it looks like this. The first year, and this is our way of, we don't want to carve them out completely because that's not fair, but we need to engage people into our community and allow them to work their way into the community. Imagine a situation where someone needs a double hip replacement and they join Liberty and then they get their double hip replacement. That's not fair to the sharing community. And so what we do is, these members that first year are not eligible, those pre-existing conditions. All other things that happen in the course of that year that are eligible are obviously shared, but just these pre-existing conditions are not eligible that first year. Then in year 2, we'll share up to $25,000, meaning we pay up to $25,000 of those eligible medical expenses. And then in year 3, it's up to $50,000. And then after year 3, our member then is fully sharing on those pre-existing conditions, right? Up to $1 million per medical incident. So in that example I gave of someone that had melanoma a year ago, if they became a member today and they had a recurrence in 3 years, we would contribute up to $50,000 toward that. However, if it were 4 years, it's treated completely new, and they would have to have up to $1 million per medical incident would fall under that. Okay, so that's how we treat pre-existing conditions. And then finally, the third thing is that we've created a system for those patients that have conditions, chronic conditions of lifestyle, okay? And we call this program Health Track. From the very beginning, Liberty has felt strongly that everyone that becomes a member should have access to the same level of education and information, regardless of who their provider is. So I know that when I speak with providers, the providers that I'm talking to are very engaged with their patients. They have stronger relationships. They're already counseling them in lifestyle medicine. But the difference is Liberty, if a member wants Liberty to be their healthcare alternative, then a member will go through the Health Track program to graduate. Okay, so about 7% of people are approved with Health Track. So that means if someone has hypertension, hyperlipidemia, heart disease, diabetes, obesity, or smoking, these are the top 6. There are a few that people might fall into. I've known of some in situ cancers that get picked up this way. And so, but in general, these top 6. And so what Health Track looks like is that once a member is approved, and let's say they have diabetes, when a member is approved with diabetes, it is not considered pre-existing to us if they're approved on the Health Track program. So it is a program that is meant to be short-term in nature, but we're basically accepting patients unconditionally. Okay, I mean, with a condition. Okay, and that condition is that they go through a program with a health coach. We give them a dedicated health coach, okay, for a short-term period of time and set some goals with them. These members pay an extra $80 a month, but they're not paying to offset their risk. They're not paying as a penalty for their disease state. That $80 is turned around and it is paid. It actually pays for the health coach that they receive. And this health coach is someone that checks in with them multiple times a week. They have a very good relationship with this person. Their health coach might email them recipes and really provide that level of accountability that is difficult to provide in the world, in the healthcare arena. And so each of these members gets their health coach. They get a set of goals or a goal. For instance, if they have hypertension, their goal might be for 2 months, they need to show or demonstrate through a blood pressure log that their blood pressures have been stable. If they have diabetes, it might be to lower their A1C, or it might be to, normalize their fasting glucose in the morning, things like that. Obesity, they will be provided with an amount of weight loss that would be recommended. If someone is overweight on a BMI chart, they will not be put on Health Track. But if they are obese, they will be put on Health Track. And they can choose to accept it or not. Smoking is a non-starter. So if someone is smoking and they do not intend to quit ever, then Liberty Direct is not a program for them. However, if a member wants to quit smoking, they're absolutely welcome into Liberty. They'll be put on the Health Track program, and they will work with their health coach to come off of smoking, to quit smoking. And then they'll just verify that they've quit with a negative nicotine test in a doctor's office. So once they've met their goals, though, and the reason why we have these goals is because once they've met them, they are a full sharing member. Okay, so they can never be kicked out for any clinical reason. And so we just want to make sure that they have access to the education that would allow them to make good choices going forward. So let's talk now about what shared expenses look like. So shared is a way of saying eligible medical expenses, things that are included, okay? So it starts with vaccines and well baby. This is a very common list of things. It should look familiar to you. So vaccines and well baby, prevention, so physicals, annual physicals, labs related to that annual physical, mammography, colonoscopies, etc. Any hospitalization or emergency room visits, any doctor's offices, any labs. Interestingly, maternity, labor, and delivery. When someone is a member and they become pregnant, obviously, if they join Liberty while they're pregnant, that's pre-existing condition. but maternity, labor, and delivery are included. Any imaging, x-rays, MRIs, CTs, things like that. Prescriptions, and I'll come back to prescriptions in a moment because they're handled a little uniquely. Chiropractic care is 12 visits per year. Physical therapy is 20 visits per year. Home health is 30 visits per year. Any ambulance or emergent transportation or transfers between hospitals. And then finally, naturopathic and alternative. I'll also come back to this in a moment as well. So a couple of things on this page. I've highlighted the first two in orange because we've talked about an annual unshared amount, right? The amount of money that that a member pays out of pocket until they're able to participate in sharing. So when a member incurs medical expenses that are prevention related, whether it's vaccines for an infant or well baby visits or any of these other things that I've highlighted in orange, these are considered first dollar shared. And so they're not, if you were to pay, let's say, for a vaccine, that does not get applied to your annual unshared amount. It gets reimbursed to you immediately. So it is not subject to the annual unshared amount. So that's a great thing. Again, we don't want people ratcheting their care. We want you to go out and seek the preventive care that is important for you. And then I'm going to move over to prescriptions now. So prescriptions are unique in that Liberty does not consider maintenance or long-term medications to be eligible medical expenses, right? So if someone has let's say an acute need, whether it's, antibiotic or a topical or a vitamin D prescription for a month, if that is something that's prescribed to them acutely, that's fine. That's an eligible medical expense. If let's say someone develops hypothyroidism and they're put on Armour Thyroid and they're on Armour Thyroid, quote unquote, forever, once the first dose, obviously, the first prescription is eligible. And then while the practitioner is manipulating to find the right dose or the right medication, all of that is eligible. But once the dose and the medication is set, going forward, those expenses are no longer considered eligible. So any maintenance medications are not covered. Now, you'll see this 45 days here. This just means that the window of time for so if someone has an acute prescription that they're claiming, they would have had to have had an office visit 45 days before or after that prescription. So that's just a time frame that should make sense, and it always correlates basically to their care. And then finally, I'm going to talk about naturopathic and alternative, because I know that with this particular audience, this is something that's of interest to everyone. And so all of these other bullet points on this screen are managed very familiar, in a very familiar way for most people. If your doctor bills us directly, or your hospital or any of these other entities, you would basically go to that entity, you'd get care, and then they would bill us, we would pay them, and it would feel like that. If they don't accept Liberty, and let's say you go to a chiropractor, you pay out of pocket, you get a receipt, you submit that to us, and we reimburse it after your annual insured amount is paid. So that's very familiar to everyone. If, however, you go to, and so just to be clear, if you go to a naturopathic or an alternative provider, or if you are a naturopathic and an alternative provider, okay, basically what that means is, rather than being able to just send a bill to us, okay, and here's the distinction: Liberty values these services and is willing to cover these services. However, they just want to see it in the form of a plan rather than a visit here and a visit there. So basically, if someone were to go to a naturopathic physician because they had, let's say, low back pain, and the naturopathic physician is working with them on both lifestyle changes, maybe some light exercise and things like that, maybe working with them on herbal preparations, tinctures and things like that. So all Liberty asks, or maybe there's an acupuncturist for low back pain, right? This also falls into this category. So basically the acupuncturist would then write up a paragraph about the patient. And in that paragraph, they would say, I really believe that for Mary's low back pain, we would do a total of, 16 visits in the first month, 8 visits in the second month. And I would be working to lessen the back pain and eliminate the back pain. And the alternative to this could be surgery or expensive medications or things like that. And so basically, Liberty just wants to know what's the plan, because they don't want to see one visit at a time come in. They want to see like, okay, what's the plan? And then they'll review that plan and potentially approve that plan. And in which case you'll basically know that for the next 2 months, Liberty has approved all of those visits that you've put in that plan. So that's how naturopathic and alternative work. It's the only kind of asterisk to the process, which is it just requires pre-approval, pre-authorization, just to make sure that it makes sense for Liberty. So they do absolutely pay naturopathic and alternative care. They just want to understand the context of it, if that makes sense. Okay, so now that we understand everything that's shared, here's a list of things that are not considered eligible medical expenses. And so this list will look very familiar because in general, it's what you mostly see out there in the world in terms of what you're used to being not eligible. The only things I will call out, first of all, is mental health. Mental health is carved out completely and considered a non-eligible medical expense. So any of our members that seek mental health care are doing so out of pocket. The other thing was long-term prescriptions, which I described for you earlier. Now, in the bottom corner, you'll see there's a SaveNet discount card that can be applied to pharmacy, dental, vision, and hearing. All members get this card. The price is included in our monthly fee, even though it might not look like that when you're enrolling. It's kind of hard to understand, but basically that card is included. You're not paying extra for it. So that is basically the program in a nutshell, okay? How your share box works, what's eligible, what's not eligible. Now, there's a facet to Liberty Direct that is unique in that we've created essentially a network of practices that are direct primary care practices, okay? And so this is what our network looks like today. And a direct primary care practice, okay, I'm going to just say it in case someone's not familiar with it, is a primary care practice. So it's either an MD, a DO, nurse practitioner, or PA in states where they're licensed to practice independently, and even naturopathic physicians who are licensed in their state to provide primary care services, i.e. write prescriptions, perform procedures, and so on. Okay? When those practices charge a flat monthly fee, right? So rather than fee for service or cash-based, there is a new mode of care called direct primary care. So those practices will charge a flat fee. It could be as low as $40 a month per individual, all the way up to $300 a month per individual. It depends on the practice. But basically, what we see on average is it's around $75 to $90 per month for an adult. And so that flat fee covers all office visits at a practice. It includes an annual physical. And then the practice agrees that they have, all their patients have, 24/7 phone coverage and so on. And so these practices, basically, when they agree to provide comprehensive primary care and even some providing urgent care and pass-through labs and things like that, when they do this, we will actually contribute on behalf of our members to their monthly membership, okay? So these doctors tend to be very focused on relationship. They may spend 30 to 45 to an hour with a patient, sometimes an hour and a half with a new patient to establish this relationship. They don't take insurance, these doctors. They want a flat fee from their patient every month. And so in exchange for that, those patients will get same day appointments. They won't have to wait for an appointment. They'll have extended visits, as I mentioned. And then these doctors very often will pass through the physician pricing on labs. So it's not unusual for a patient to get a $20 bill on a comprehensive set of labs at their annual physical, as opposed to a $400 bill being submitted to the way things work with an insurance company. Okay. So these doctors go to the extent of they're focused more on the relationship, that they're willing to just pass through cost savings measures to their members to make their membership more and more valuable. And they offer telemedicine. Some of them have in-house dispensaries, obviously for nutraceuticals, but also for pharmaceuticals. Anyway, basically these practices have taken this look and feel of a traditional office and have turned it into this. Okay, that's their whole goal, is to really work very, very closely with their patients. So the way we contribute toward that membership, because we believe that there is just the ultimate value of prioritizing your health in one of these environments, and the ability to save money without really going out of pocket. If you pay a flat fee every month, then you're not going to pay every time you go see a doctor. And so this is what it looks like for an individual. If a member of Liberty joins a direct primary care practice, one of our premier practices, we pay that practice $60 toward that membership. For a couple, we pay $80 toward that membership each month. And for a family, we pay up to $100. So in many, if not most cases, our stipends pay the monthly fee for our members. So they're able to get almost concierge level care or concierge level care without having to pay that monthly fee. Okay? That should make sense. So that basically explains how Liberty Direct, the actual program of Liberty Direct, engages with members above and beyond just the basics of medical cost sharing and our eligible expenses and our ineligible expenses. So we know that Americans need a better way, and we feel very strongly that for those who are health conscious, we have the ultimate solution for them. If you'd like, you're welcome to like us on Facebook. We're always kind of sharing information and chatting out there. And I think now is probably a great time to open up the floor for questions. I'm going to go to that questions pane. However, if you're interested in enrolling, okay, PMA wants to make sure that they can service you and support you in any way. So they've created a place on their website to go ahead and join. So pmai.us/liberty. You can enroll through there. You're always welcome to go to our website and chat. We have a live chat team. We have a phone number. You can call us. You can talk to us, ask lots of questions. Our live chat team is up about 18 hours a day now with this open enrollment period going on. It's worth mentioning that we have no open enrollment. You can always join Liberty, but it happens to be ACA enrollment period. But when you're ready to enroll, I would definitely encourage you to go through the PMAI website, just because the team there wants to make sure that they can also respond to your needs as well. So I'm going to go ahead and open up the floor for questions. If you have any other questions that were not answered during the course of this webinar, definitely go ahead and type them in now. And the first question that I have is can this program complement a current insurance plan? And so the answer is that you could. In fact, it even can complement Medicare. However, I think if you look over the listing of the eligible and the ineligible services, you'll find that most people don't use this as a supplemental. Most 99% of people use this as the primary, but it could be used as a supplemental. Okay, so the next question is, what is the size of Liberty in terms of customers, and in what area of the U.S. are they strong? So we are strong across the U.S. We're probably we're seeing more uptake, obviously, in those states that are, I would say, more open-minded and seeking out alternatives, as well as those states that are where healthcare is outrageously expensive. So, for instance, Wisconsin happens to be a state where healthcare is quite expensive comparatively to the rest of the country. So in that, we see people in those areas, Utah, Colorado, California, but the whole East Coast. I mean, it really is quite well distributed. And as I mentioned, we have 90,000 members. The only thing I will add is that the state of Pennsylvania is the only state that is prohibited for liberty. And the reason is it's kind of a long technology reason. Actually, it just happens to be that the way the law was written for medical cost sharing doesn't work with the way our technology platform is based. And so it's very unfortunate. And we're working on actually a workaround and a solution so that we are compliant in Pennsylvania. But as of today, we are not. Okay, what if a member or an applicant does not have or follow a faith? It's a great question. And so our shared beliefs, you can see our shared beliefs on our website. The shared beliefs are written to be inclusive of essentially the rights that people have. And basically what you're saying, so I'll be clear. The other medical cost sharing communities, you have to either sign an attestation that you are a Christian in good standing, or you have to have a letter from your pastor indicating as such. With Liberty, you have to subscribe to the shared beliefs. So I'll give you an example. One of the shared beliefs is, I believe that all individuals have the right to worship the God of the Bible. Okay. And so there's no question that this might not work for someone. And unfortunately, I understand it, but that, our exemption is essentially religious based as well. So I just want to present it in a fair and open light that, you're really attesting to the right of people to have this freedom of religion. But again, that might not work for everyone. And I completely understand it. Okay, so the next question is, if someone is accepted for membership on the health track program, let's say for something like obesity, okay, which is fine. So health track is that program, remember, the conditional acceptance, $80 a month, and they get a health coach. If that person has an event unrelated to his or her obesity, perhaps diagnosed with cancer in this example, this hypothetical example, would the cancer expenses be shared? And so as long as that cancer is not pre-existing, absolutely. Understanding where this question is coming from, which is, depending on the form or the style or the practice of medicine, the philosophy of medicine that you subscribe to, some of us believe that obesity, right, increases the risk of cancer. That is not the way it's viewed in terms of the way eligible medical expenses are seen. So in this example, someone who's on health track for obesity then develops cancer. Yes, the cancer is an eligible medical expense. Okay. Would Liberty Direct cover a nutritionist and the prescribed supplements they recommend? Great question. So again, that would fall under, believe it or not, under the alternative category if it's not written by a physician or a licensed practitioner. So basically, a plan would be put together and so on. Now, so supplements are interesting. Supplements are treated the same as pharmaceuticals. So if they are acute, they're eligible for reimbursement or applying them to the annual unshared amount. If they are long-term, first of all, they have to be therapeutic. They can't be preventive, right? So if someone has high triglycerides and you've got them on fish oil, or someone has arthritis and you have them on fish oil, those are therapeutic applications, right? And so in that example, the first dose, the first prescription, if you will, would be eligible for sharing. And then once it becomes maintenance, it would not. So in that example of fish oil, I would say as a member, I would probably want to buy the biggest bottle of fish oil that my nutritionist recommends. So I hope that answers that question. Define negligent acts if not covered. So negligent acts are pretty straightforward. So let's say you're robbing a bank and you get shot while you're robbing a bank. That's negligent because you were doing something illegal at the time. That's different than hazardous hobbies. So skydiving is considered a hazardous hobby. Rock climbing is considered a hazardous hobby. Interestingly enough, private pilot is not. Um, Horseback riding is not. Hunting is not. So just to be clear on that, what considers a hazardous and not. But negligence is usually in the act of doing something that's not legal at the time. Do you have an estimate of how many doctors participate in the program for Philadelphia? So I hope I answered that. Unfortunately, we don't have any in the state of Philadelphia. I mean, in the city of Philadelphia or in the state of Pennsylvania, because we are not eligible in the state of Pennsylvania right now. So when do I think we'll be compliant? Although I will tell you, I probably have about, maybe 15 to 20 physicians on a wait list for once we are able to open up. And we have several in the Philadelphia area, as well as in the like Langhorne, Bucks County area, and so on. And then in Harrisburg and Pittsburgh. So we do have doctors that are kind of waiting in the wings. We just have to get this through legislation. So hopefully that makes sense. When do I think that Liberty will be compliant in accepting members? We're working on it right now. In fact, it's an issue with the way the law was written related to banking. Basically, the law says that every member of a medical cost sharing community has to use their own bank account. And that's because when medical cost sharing first started, and the way many of the others work today, is that as a member, you write your check to another member's name and you send it to their home to pay medical expenses, rather than having it all coordinated and using technology to organize it. And so they thought they were writing the law to be favorable. And when they wrote the law that every member has to have their own bank account, it actually meant that as a member of Liberty, every member has to have their share box has to be a separate bank account. So that's kind of a long-winded story to get there. Is there a list of providers in Texas? So I do want to say this just to be clear. You do not have to, it's not a requirement that you use one of our premier practices, a direct primary care practice. You can choose any doctor you'd like. It's just that if you use a direct primary care practice that is one of our premier practices, you benefit from that monthly stipend being paid toward your membership fee. And if it neutralizes that fee, that's even better, because then all of your office visits and annual physical and things like that there's no out-of-pocket expense for them. And so that's the only benefit. You can look on our website. There's under individuals and families, there's find a premier practice, and that will take you to a search where you would see that map. And I like to just drill into the map so that I can find out where I'm looking for. But there are lots of providers in the state of Texas and in Houston. So you can go ahead and dive in there. Someone asked that question. Okay, so this is the last question I have on my list. I've got a couple more that have just come in. But if you do have a kind of a burning question, I would encourage you to ask it now. So if a patient came for a one-time treatment, should I charge him rather than send it to Liberty? Send it to the insurance since he's not going to have a plan. I'm not sure I understand this question. I'm not sure I understand what it means that should you send it to insurance since he's not going to have a plan. I don't know what that means. Also, just to be clear, we are considered medical cost sharing, so we don't ever call ourselves insurance. We are medical cost sharing. We're very clear because we are delineated in the Affordable Care Act as being exempt from that. So we can't use the terms of insurance like insurance or deductible or premium and so on. But I'm not sure. I apologize. I don't think I understand that question. Okay, if you want to retype it in a different way, I'm happy to come back to it. So the next question that I have is, so do I have to have a Liberty Direct Premier practice to enroll as a Liberty Direct member? So you got that answer. Absolutely not. You can go to any doctor you'd like, any hospital you'd like. There's no network. There's no pre-authorization for anything other than, as I mentioned, naturopathic and alternative care. Okay, so what happens when I go to a doctor's office other than a Liberty Direct doctor? So that's a great question as well. So basically, the doctor that you're going to, they may already choose to bill Liberty. I mean, you as a member, you get a card. It looks very familiar to the way insurance works today. You get a card, It has your member ID on it. It has your effective date on it. On the back, there are phone numbers to verify benefit. And then that provider could choose to just bill Liberty directly. They could call and get set up and everything would be fine. If they choose not to, they may ask you to pay them in advance, or if you've been seeing them for a while, they may bill you, in which case you would submit that to Liberty. Okay. So one, if they bill us directly, you have nothing to worry about. They bill us. If they ask you to pay and you pay, you would just, like I said, even from your smartphone in your car, you can take a picture of it, upload it into your share box, and you have submitted it to us that day. We'll reimburse first it'll be applied to your annual uninsured amount if there's any amount there that needs to be met. And then once you've met your annual uninsured amount, we would then pay you back, reimburse you in about 30 to 45 days. Okay. Do I have a deductible or a copay as a Liberty Direct member? So as I mentioned earlier, we don't use those terms. So your annual unshared amount would be the amount that you're responsible for paying out of pocket. So an individual is $500, the first $500. A couple is $1,000 a year, and family is $1,500 a year. And that's not per person. That's combined, and has to be allocated a certain amount per person. That's not true. It's just one big number. Okay. Copays, no, there's no such thing as a copay in our world. So it's pretty simple that way. The next question is, what criteria can a practitioner be qualified to be paid for a service by Liberty whose clients is a share member, or does that matter since the client can pay and send in their invoice? Right. So if a practitioner chooses to bill Liberty directly, they basically call the number on the back of a member's card and they'll be set up. Liberty, when you're set up that way and you choose to bill, Liberty pays 150% of Medicare for office visits. They pay 160% of care, 150% of Medicare for inpatient, and 170% of Medicare for outpatient hospital services. And so if you agree to those terms without any negotiation on any given one service or anything, then that's great. You bill us directly, you get paid directly. We pay within 30 to 45 days, and it's beautiful and simple. If, however, you require more, you would likely either bill your patient directly, in which case your patient has a choice to go to someone that will bill Liberty or for less money, or you could charge Liberty more, but then that'll probably go into a negotiation discussion because of our rates. So, but it doesn't matter, because if you bill the client and the client pays you, then they submit the bill. It's going to be applied to their annual uninsured amount or reimbursed accordingly. Do you cover thermography screenings? Yes, absolutely. However, it's either or, it's not and. So you can have a thermography or a mammogram, but not both. And so the way our coverage works is that so anyone 50 and over is eligible for a quote unquote thermography or mammogram each year. If you're under 50, it's every other year. And so if you use exclusively thermography, that's fine. If you use exclusively mammography, that's fine. And if you choose to alternate every other year between thermography and mammography, that's fine. It's however it works for our members, but thermography is absolutely an alternative that is eligible. Will my doctor like Liberty Health Share as a method of being paid for services? So as I mentioned earlier, we find that most primary care doctors especially are thrilled with a guaranteed 150% of Medicare, regardless of what state you're in or what geographic area, because it's based on Medicare rates. So we find that that's terrific, most primary care. I think where we run into issues is specialists, very often depending on the specialist and depending on their training and maybe their reputation, they may want to bill upwards of, 250% of Medicare. As a member, and I will speak to it from a member perspective, the beauty is no matter what is charged, you are not responsible for the difference. Okay? There is no balance billing that will occur. So that's important to know as a member. What we do is we have a negotiation team. So let's say a hospital submits an outrageous bill. Our team will immediately, on behalf of our member, reach out to credit reporting agencies, inform them that that this charge is under dispute so that it can't adversely affect your credit rating. And then they work very closely, and they'll negotiate this team that I'm talking about, they'll negotiate potentially higher than 150%, but it's a process and it takes time. And so very often practitioners say it's just easier to know that there's no hassle. I'm going to be paid within 30 to 45 days. And it's great. And I'm happy with it. In fact, we have lots of hospitals, hundreds and hundreds of hospitals that prefer this 160% of Medicare, no questions asked. And they're happy with that. In fact, they've told the premier practices, we love taking care of Liberty Direct members. So that's how that works. Okay. Someone thanked me and said it was great. So great. I'm glad you were here. The next one is there a way to become a thermography provider through Liberty? How's that done? So no, in fact, we don't have a network, so to speak. It's just that if you are providing thermography to one of our members, they would pay you. Oh, you're suggesting that maybe you would bill us directly. Sure. So when you get a Liberty member, on the back of the card, there's that phone number. You just contact them as a provider, or you can call. There's an 800 number on the website, but you can call and work out a relationship that way. That's absolutely a possibility for sure. That's a great question. Okay, so I'm looking through. I think I've got all the questions answered. And yep, I sure do. I really want to thank you very much for taking the time to learn about the program. As I mentioned, absolutely jump on our live chat if you have other questions, maybe more personal questions that you want to get answered, or anything like that. What is today's date? Today's date is the 29th. So December 1st start date is probably unlikely unless someone were to apply I would say by the end of business today. Otherwise, January 1st is the next available slot because it's the first of every month. So thanks again, everyone. I want to thank PMA, Dr. Carter, Larry, who introduced me. Thank you all very much, and have a wonderful day.